Good afternoon.
Good afternoon.
Today we are going to see about OSCE. They are the 8th semester students here with me. In the 8th semester examination, they are talking about the OSCE. The INC told that all year, first year, second year, third year, whatever you are studying all the semester, combined together in a 5 subject OSCE. Okay, maybe MSN 1, MSN 2 if it is there, or specialty or adult health nursing, whatever they are telling, with fundamental they merged as a one OSCE station. Then will be mental health nursing, another OSCE station. Community health nursing will be another OSCE station. Then will be pediatric will be another OSCE station. Gynecology and OBG will be the another OSCE station. So the 5 major subjects has been ordered. What is OSCE? Can anyone tell what is OSCE? Objective? Objective, structure?
Objective, structure, test,
clinical evaluation. Objective, structure, clinical evaluation. Are you understanding? That is called OSCE. Here, we are here, gather here to discuss something about what are all the possible OSCE points or station we can organize in our college. Are you understanding? Yes. Can anyone tell what are all the points we can organize? What are all the tell me, what are all the things?
Ma'am, drug calculation. Drug calculation can be there, various postures and their uses, various instruments and their uses.
Okay, now she told me drug calculation. Just I want you to know what is the drug calculation. For example, I will tell you one thing. Then you will tell me. For Mrs. Uma, needed to administer 2000 ml of normal saline in 24 hours. What is the drop factor calculation? Can you tell? You know micro factor, macro factor drop. 20 drops per minute. So how many drops will you set it? You repeat the formula. Tell me the formula. Formula is
the volume into drop factor by time in hours into 60.
Here is 2000 into
2000 into the drop factor for
is 20. Drop factor is 20
and divided by 24 into 60 and it was 28 drops per minute.
Very good. 28 drops per minute. Okay, give it to her. What else the station we can make?
Ma'am, after that we can include various instruments and
yes. Can you tell me what are all the instruments?
Ma'am, ambu bag prepare.
Instruments, ambu bag. Yes, here we have ambu bag. So you can keep the ambu bag and we can tell them to mark the parts. If you do not have the ambu bag, no need to worry. You can take a picture of the ambu bag, then mark the parts, you can relieve it. That where, can you tell, explain anyone about this ambu bag? You show, she will explain. You explain.
And this part is known as the self-inflating
ambu bag side, and then?
And this is the air valve we are connecting. Here one tubing is there.
Here one tubing is there.
There we can connect the oxygen tube.
Oxygen tube you will be connecting. Okay. Connect it. How will you connect it? Yes. Okay. Okay. Then?
And this will be the mask through which we will provide the ventilation to the patient.
If this is the mouth, how will you provide the ventilation?
From behind of the patient, we will provide the ventilation. We will hold the cup in C shape and we will cover the nose and the mouth of the patient and the self-inflating bag. We will press it. We will count 1, 2 and 3.
1, 2 and 3.
Then again we will press it.
Very good. Super. Very excellent. So like this, you can put it and you can make them to do that, see the technique. Are you understanding? Okay. Leave it, later we will do it. No issues. And you tell me what are all the other stations. Now we know what is the drug calculation. Mr. Uma or somebody, this much NS. Now you have told the drop factor. Excellent. This is the one best thing. And she told about articles, equipments. Any forceps can tell what all the forceps can be used?
Tooth dissecting forceps.
Tooth dissecting, non-tooth dissecting, artery forceps,
Alice forceps,
thumb forceps,
Kocher's forceps, then Babcock forceps.
Babcock forceps. What is the purpose of that?
In Babcock forceps, ma'am, we are using that in any intestinal surgeries to clamp the small arteries that are present in the intestine to prevent any bleeding that is not necessary. Or
Yes.
to
So which year she has studied? Which year you have studied, ma, this one?
I'm in second year.
In second year, in a fourth semester or third semester, she might have studied. Now currently you are in a
8th semester.
8th semester. So it is INC has kept it to recollect it. So it is helping them to enter into the job entitlement. That's a very beautiful change INC brought. Are you understanding?
Yes, ma'am.
Yes. Any other questions you can? Any other thing?
Ma'am, various postures.
Give it to her. She wanted to tell. What are all the various postures? Yeah, tell the postures and important. There you can tell.
Ma'am, positions are supine position, prone position, side lateral position, lithotomy positions, and ma'am, for supine position, ma'am, we for any chest and abdominal surgery, we used supine position, or in the prone position, we for any back assessment or any back surgery or any rectal examination, we use that position, ma'am. Then in lithotomy position, ma'am, for parvaginal examination, then any delivery, then in side lateral position, ma'am, we use
left lateral.
Yes, ma'am, left lateral. We use that position for spinal anesthesia. Then, ma'am, any spinal assessment, then for enema, ma'am, we use that
very good. So you understand what are all the positions. So how we can, what are all the articles as a teacher, how you can, you are going to be a teacher. So what do? You can give the position chart if you cannot. Are you understanding? Or traction, you can give the traction. What is the kind of a traction? Child will write, this is for the implications, this position for what are all the surgery. So you can give the mark. Are you understanding? OSCE is so interesting, right or not? Any other thing?
Then biomedical waste. For biomedical waste management, we can include some dustbins which.
What is biomedical waste management? First of all, the waste which is generated during the time of dressing or during the time of admission to the discharge to the procedures. Whatever the scientific procedure they are undergoing, that is called the biomedical waste. Are you understanding?
Yes, ma'am.
Not the waste developed during eating or cooking. It is the diagnostic to the treatment measures. What are all in between, what are all the procedures going on, those wastes are also called the biomedical waste management. Now you explain in detail about how, you tell what is biomedical waste and then how we can apply in a OSCE form. We will.
In the biomedical waste management, we will keep
Loudly tell.
In biomedical waste management, we will keep some dustbins with their color coding. Means black, in which we will discard the general waste like paper, plastics, etc. Then in the red container, we will discard the plastic materials, hard plastic materials. Then in the yellow, we will discard the human products, means and the cytotoxic drugs. And in the blue, we will discard the sharp materials, broken glasses, and blades, these things. And in the PPC, means puncture proof container, we will discard the syringe, needles, etc.
Very good. Okay, since this okay, color coding, how we can prepare as a form of OSCE? You can, like what are all the waste she told, you can put it. Students can write, this is what color green.
Yes, ma'am.
Like that you can write it. Are you understanding? If she told me, and we will put the container. Okay, if you cannot put the container, you cannot bring, you can make it in a paper.
Yes, ma'am.
When she is telling a color coding, I remember one thing. Do you know triaging?
Triage.
You have seen? Yeah. Can anyone explain what is triaging? Triage also can be kept in OSCE. Yes.
Ma'am, triage is coding the patients according to the severity of conditions and treating them based on their priorities. There are
So how as a form of OSCE we will bring it? Maybe we will put one dead body picture. Are you understanding? Then she will write this dead body picture. If I see, I will write a black color. Minor injury, one person is walking with sitting like this. So you can put it's a minor, green color. One is a severely ill. So you will put a red color. So you can, no need to bring a big data or something. Just you go to AI, ChatGPT, bring the man affected, very seriously injured with a head injury, bring the picture. But a minor SCLAD or something, it will give. So organize the picture and put it in your the exam. Very simple. So children are knowing about what is the color coding, right or not? Virtual identification is very important. Okay, that's about the going. Anything else?
Ma'am, then various stages of
Stages of wound healing, types of fracture,
yes, ma'am.
right or not? Or you can put a X-rays. My father, when hand is broken completely, that whole brain like this. You know what are the types of fracture?
Yes, ma'am.
Simple fracture, hairline fracture, complete fracture, compound fracture, complicated fracture. Are you understanding? So the X-rays you can collect it from where the X-rays you can put it. Those students will have a knowledge. Are you understanding? So interesting. Next is a
Ma'am, we can keep different sutures to identify.
yes, different sutures. Maybe the suture may not be opened. Different kind of a suture, absorbable suture, non-absorbable sutures, and different kind of a needles which is used for the surgery. Right? You have seen curved needle holder. You have seen needle holder. Inside you can see this is a needle holder. It looks like artery forceps. So that student will tell, madam, it is artery forceps. You correctly open and see. So once you open, yeah, it is a needle holder. So the forceps you are keeping and the needle also absorbable. How you will find out? Different kind of a catheter you can keep it. What is the gauge? What is the gauge and what is the implication? Are you understanding? Sometimes we have a catheter, stainless steel catheter. You can ask them, this stainless steel catheter for whom it is? Mainly for the burn patients or something. Are you understanding? So you, and the needles, butterfly needle and venflon, or different kinds of that, you can ask them. If 5 questions you can ask them, how often you will be changing. If there is a IV fluid you are putting, you are not changing in 72 hours, what is the disease will come? Phlebitis, right or not? Thrombophlebitis, thrombus, septic shock, what the child is writing. So because we are not studying a rocket science, we study the human science. So the application is very emergency. Rocket is going, crores will be go, but life is going. I can put another 600 crores also. I can buy another rocket, but the life once going, the life cannot be. So the importance the OSCE is teaching. Anything else?
Breast cancer.
What you do with breast cancers?
The stages of breast cancer.
Yes, stages of breast cancer. You know, one mother simply irritation, only ulcer. That's the initial stage. Not gone to that. But you know, another mother, I have a picture that a complete breast is many swollen and everywhere it is bleeding. That is a final stage. Breast is a finishing initial stage and nodules. So find out the ChatGPT the picture. What is the stages? Wound healing. You know wound healing?
Yes, ma'am.
Stages of wound healing. So they will go to pathology also, they will be studying. Are you understanding?
Yes, ma'am.
Anything else about the specialty subjects?
ENT.
What ENT you can do it?
The instruments of
Instruments of ENT, you know, otoscope, right or not?
Yes, ma'am. Nasal spectrum.
Nasal spectrum, how you will do that, otoscope, how you will be seeing, where there is a light, how she will be, make her to use. Neurological assessment, you know, tonicue, hammer, knee hammer, right or not? And then ENT assessment, there will do no one. Tunic forceps or fork. We will fork. We will be doing like this.
Yes, ma'am.
Right or not?
Yes.
Make the child how you do the OSCE, assess the neurological assessment. Set the tray. Let her do what is that? What nerve you are assessing.
Yes, ma'am.
Are you understanding?
Yes, ma'am.
She will know olfactory. So she is remembering anatomy and physiology. That is the only one nerve I can visualize is the retina. That is the optic nerve. Second cranial nerve I can visualize through the ophthalmoscope. So she should know what is ophthalmoscope, which is what is called the ENT. Are you understanding?
Yes.
Okay. Anything else? Tracheostomy, anything?
Tracheostomy.
Tracheostomy tube. There are different types of tracheostomy tubes. Are there no?
Cuffed.
What is that? Cuffed tube. Then will be uncuffed tube, and then fenced tube. Then will be metal tube, and the cuffed and the flattened tubes.
Yes.
There are many size and tubes are there. Ask them to identify. You don't have that tubes, please bring the pictures and ask her to identify. Are you understanding? Anything else? Next.
Hot and cold application.
Hot and cold applications. So they have to identify. You know Nelson's inhaler?
Yes.
Nelson's inhaler prohibited completely.
Yes, ma'am.
Because that is already in this cold climate, you put water, it is not going to, air is not going to come. That they are taking it, it's going to the lungs.
Yes, ma'am.
So you are using the different kind of this one. Then infusion pump, you know infusion pump?
Yes, ma'am.
There are some drugs are given, dopamine, dobutamine, right or not?
Yes.
In the infusion pump, in a slow manner it will be given. What is the calculations, infusion pump, how will you, for example, I will tell you, now I will tell you, your infusion pump calculation. Kumar, 60-year, admitted in CCU, their supportive care has been given prescribed dopamine at 4 microgram. But you have to see what is the available. Ampule is 4 microgram, one start you will be giving. His weight is 70 kg. Are you understanding? What you find out first? First one ampule containing how much? You explain.
First, I have to take the body weight into 3.
Body weight into 3.
Then whatever we get, we will multiply it with the 5 ml, means the thing I have given. It will be divided by the 250 mg.
Boil 5 ml, one ampule is 250 ml. The 250 ml is mixed with the 5 ml.
Yes.
Are you understanding? Then I will be body weight, how much it is. So into 3, then I will be calculating. 4.2 ml I will be giving. Are you understanding what is the starting? She is telling that start with a 4 microgram. Are you understanding?
Yes,
so 4 microgram, it is coming in a what? How many ml? This is 250 milligram, and then you have to convert into microgram and convert with ml, and you have to give. Next is saying you to prepare the dobutamine drug. So how much ml of medicine is there? How much ml is this one? Is a 2.5 is a dobutamine, means here will be 48.5. So you will be overall will be this one. And the slow dopamine, dobutamine, slow infusion you will be giving to the children. And the nurse's responsibility, what? Dopamine, dobutamine, you have to check the blood pressure, BP, vital signs. You have to check which cardiac drugs when you are giving.
Yes.
So these are all the questions you can formulate for the children. So they will remember for the ever. Anything else? What is ECG? Electrocardiogram. Anybody underwent going to ECG anytime?
No, ma'am.
No? Okay. ECG, you have to know, as a nurses, you have to take a ECG, right or not?
Yes, ma'am.
You know the color coding. So you have to give this one, where to keep the lead 1, lead 2. And the lead 3, lead 4, lead 5. Then right hand, left hand, what is the color? Leg, what is the color? Chillers missing, very nicely, you just connect it, just on, ECG will come. This one station you can keep. If not, there is a normal ECG, normal sinus rhythm, bradycardia. That PQ, what is it? PQRST. PQRST. This is the PQRST is the telling about the electrical functions of the heart. So this one very nearby, that you can various different form of a ECG available. Go and ask your parent hospital technicians. Collect it, take a strip of it, tick it. Only one, not a full ECG, no need to keep. Just a part of it, cut and keep it. Then students will identify bradycardia, tachycardia, cardiac failure, they have to identify. It's a very nice station to make it as a ECG. Tough, but even then you have to learn. Conduct one workshop on ECG. Call the technicians and talk. Along with that, one medical surgical doctor. Conduct one-day workshop session. So the students will be in hands-on training. Bring the machine from your hospital and bring the ambulance. Ask the ambulance driver to teach it. Identify cirrhosis of the liver. Are you understanding? First stage, second stage of cirrhosis liver, what's happening? Then urine sugar test. In a lab only we are doing the urine sugar test, right or not? Then what is the color? Blue color, right or not? Blue, no, this one, +1. Blue, green, yellow, red, yellow, orange, red, brick red. Plus, we are adding. +1 means how much is gram? Approximately, it's not a correct value, how you are doing.
Yes, ma'am.
Or you keep on glucometer. Tell her how will you do the technique. Every house they are having a glucometer. India is the capital for diabetes mellitus. So we have banned the test doing the Benedict solution. We are taking to the community with the glucometer. So we can do the glucometer. Right or not?
Yes, ma'am.
So, okay. So then images of abnormal images, genetical abnormality. You know, no?
Yes.
Trisomy, Down syndrome. Right or not? That images. Why the Down syndrome? What is the causes? Ask them to write. Identify features of the Down syndrome. They can picture. They can mark. They have the eyes like this, ears like this, nose like this. Right or not?
Yes, ma'am.
Huh?
Yes, ma'am.
Okay. Then about the pigeon chest, kyphosis and scoliosis, letharism. The West Bengal people, most of the women where I was staying in the last, yes, letharism. That lady's age is only 55, more than 5-6 years. Yeah, she cannot get up, like only 30 kilo. If you collect her history, they continuously eating the lentil, the pink color lentil which they are providing in the ration shop. Then you are asking me, ma'am, I am not supposed to eat ration shop lentil. Why I am not supposed to use? Because this lentil have the bioxyaminoalanine. Are you understanding? BOAA. BOAA, bioxyaminoalanine. When they cook, they go for letharism. They affect their bones, kyphosis, like a colossus, all these things, they are shrinking. So what to do? The poor people, government is doing. Is it a sin? Everyone, even I go and get the rate from the ration I bought also. What I have to do is, I have to soak in a warm water 10 to 15 minutes. Soak and remove the toxins. Then you can consume. No letharism. Are you understanding?
Yes, ma'am.
Okay. Then food adulteration also sometimes you can. Adulteration. They are studying. Though you can give what are the adulterants, the image or what probably adulteration you can ask. Then different kind of oxygen administration. You know, tent. Right or not? And then complication of this one. How many liter in tent they are giving? Nasal tube cannula. How many liter is the maximum? What all the things are there? National cannula is there. Oxygen tent is there. Face mask is there. Right or not?
Yes, ma'am.
Different mode of administrating of the oxygen. Right or not? Then you can keep them the syringe. Mark the parts of the syringe. Or you can keep the picture of syringe. What are you understanding? Identify. Where is the what is the give her? What is the syringe? What they will tell? Needles.
Needle plunger.
Tip of the needle, shaft of the needle, hub of the needle. Are you understanding? So you have to mark the parts and how you have to give the techniques. Are you understanding? If you want to have skill, you want to assess, keep one smiley ball. Ask the students to put the air and push the air, how she will hold it. You can see the technique. Are you understanding?
Yes,
then identify the PPE. What is PPE? Anyone can tell what is PPE?
Panchaproof content.
PPE. What is PPE?
Ma'am, personal protective
Can you list down what are all the personal protective equipments?
gloves, face shield,
Gloves,
mask,
face mask, goggles, gown, surgical gown, shoes, shoes cover. So what will be asking? For what purpose? If I put gloves, for what? Examination or prevention of infections, right or not? Two purpose. Gown. We all have wear the gown, no? Traveling. 2021. Here indigo. They give big gown. Yes, because of the corona. Face shield. Some of the such flash injuries. Prevent the flash injury, protect the eye, prevent the cross infection. Everything prevent cross infection. Parameter. Temperature, pulse, abnormal. What you can tell? Temperature, pulse, abnormal. What is the normal pulse?
60 to 100 beats per minute.
60 to 100. If it is more than that, tachycardia. If it is less than that, bradycardia. Then the sound. There are different kind of sounds will be coming, right? Auscultation, right or not? Percussion. Yes. So how to do the abdominal examination? So these are all ASCII. ASPE also physical examination. That I can put her as a model. She is the model. You will tell her. So you will tell her. She will be verbalizing to the. She is the patient. I am the student coming. I am going to diagnose her. So she will be telling her symptoms. She is telling that I have a night sweat, cough, and weight reduction. And just is like this. So she has to write what is the diagnosis. What is that? Pulmonary tuberculosis. Are you understanding? So these are all the ways. These are all the ways to make the people to think and recollect. INC has kept it for recollecting the knowledge what you have studied from the first year to the last year. So can we tell what all we have seen from the beginning? First bag? No, first what we have told? First
Drug
one?
calculation, ma'am.
Drug calculations. Then bag. Then positions. Then we have seen about the various forceps. Biomedical waste management, color coding. Then will be infusion pump. How will you calculate it? Then will be triage. Triage, color coding of the triage. Then we have seen about wound healing, breast cancers, stages, fractures. Are you understanding? So there are cannulas, ENT tube, catheters, different kind of catheter, and child, what is the size of the catheter, tracheostomy tubes, parts of ENT tube, parts of the syringe, parts of the needles. You cannot bring the original, you can put it in a pictorial. Are you understanding?
Yes, ma'am.
Hope you have understand.
Yes,
what is the possible OSCE questions will be asked in the medical, surgical and fundamental of nursing. Okay, so the next topic we will see about either the OBG or community. We will get ready and we will have. Hope it is useful for you. Please subscribe and follow us and get benefited. Thank you.